Approximately 4,100 exhibitors showcased their latest technological innovations at CES 2026 last week in Vegas, including health tech platform Transcarent. Joining me now with the details, Glen, Transcarent's CEO. It is great to have you here. Good morning to you. So last week at CES, you spoke about the future of healthcare, what the industry might look like in the year 2035. What was your key message to attendees?
Well, first of all, it's great to be on this morning. Thanks for having me. I think the key message is what we're seeing in healthcare is we're moving from the search era to the chat era to now the agentic action era. So we're using AI to make it easier for people to access high quality, affordable health and care. And that really makes their lives easier in healthcare.
Transcarent also made a bit of news on some new agentic artificial intelligence capabilities while you were at CES. Take us through those and the problem you think the company is solving in the general healthcare space.
Well, I'm glad you mentioned problem because this isn't really about technology. I think your last speaker mentioned it as well. It's about AI should blend into the background and we should solve the typical problems people have. And if you think about it, healthcare today is more confusing, more complex, and more costly than ever before. People say it's getting worse. So we want to attack the basic problems, which are, for example, I have something wrong with me. My knee hurts. That's a symptom. What do I do about it? How do I find a doctor? And most important, how do I schedule care? And what we've done is used AI to make it easier for people to just talk to their phone, ask any basic question, and get an instant answer. Is it covered? One big question that people ask. What does it cost? These are basic questions that in every other industry we can answer except in healthcare. And now, for the first time, Transcarent makes it easy to answer those questions for any health consumer.
I've got a basic question for you, at least for me as the interviewer here today. What is your Wayfinding platform and how are people using it?
So Wayfinding just refers to this capability that allows people to talk to their phone in English and Spanish and Japanese and ask any question about, I hurt my knee, what should I do? Should I get a second opinion? And we have the leading second opinion company in the world to ask people before they go and get surgery, do you actually need surgery? How do I find a high quality doctor? Or can you schedule an appointment for me next Tuesday or Thursday? And the agentic AI capabilities embedded in our Wayfinding platform can actually do that for you. And this is just revolutionary because healthcare is so confusing for people that a lot of people just don't get care. And people don't know what care costs. So for the first time, is it covered? Is my MRI covered? Where should I go to get it? Are they in network or not? These are all the basic questions that we struggle with. And Transcarent, for the first time, is making it easy for people to get access to care 24 hours a day and find high quality providers and then actually get that care, and sometimes in 60 seconds or less. So imagine that. You can now talk to a doctor and text with a doctor, a real doctor, in 60 seconds. Pretty cool.
Glen, almost out of time. What can your Wayfinding platform do now that it could not previously do?
Well, I think there's a few things. One, it can remember what you forget. When you're under stress, I don't remember what the doctor said. Can you remind me? It remembers. It can remind you to pick up your prescription. It can actually get Amazon to deliver your prescription to your home. These are things that we only dreamed about in the past. Transcarent's making them real.
Glen, Transcarent CEO, congratulations. Thanks for joining us.
Thank you.